So, the following are the underlying conditions that cause fatigue. Just like we said, that fatigue is not a disease, but it's just a symptom of a wide range of diseases, disorders, and some deficiencies, and that it really affects the body. And we have very many conditions that really lead to fatigue. So, the moment you experience this fatigue for a period of like over 2 months, please seek for medical care. There are some experiences of fatigue that may come shortly. Like it may happen like in 2 days and it stops. But there are some critical conditions whereby you just experience fatigue and you don't know the cause. So the moment you experience this fatigue for so long, please just seek for medical attention and you'll be okay, trust me. So we can define what a disease is, what a disorder is, and what a deficiency is, since we've seen that there are some underlying conditions that bring fatigue. So a disease is a condition of the living animal or a plant that affects or impairs the normal functioning of the body, and it's typically manifested by signs and symptoms. So someone who has a disease, they will always have signs and symptoms. So that's a disease. Then a disorder, this is a disturbing of the normal functioning of the mind or a body. We have very many disorders. We have anxiety disorders, depression, things affecting the mind, and so on. Then you also have deficiencies. A deficiency, this is a state of lacking some necessary qualities or elements. Like there is something you're lacking, that is called a deficiency. So I'm going to state these conditions accordingly, since we've seen that most conditions are either disorders or deficiencies or diseases. So, the following are the underlying conditions that cause fatigue. So, we can as well classify them so that we can identify them very well. So, we have infections. Infections bring fatigue. For example, HIV, COVID-19, flu, pneumonia, bacterial infections, all those ones bring fatigue. Parasitic infections like malaria, all those bring fatigue. We also have heart and lung problems. So, the heart and lung problems are also under the classifications of diseases that bring fatigue. For example, heart diseases, lung diseases like COPD, that's chronic obstructive pulmonary disease. We have emphysema, congestive heart failure. We have postural orthostatic tachycardia syndrome. All those bring fatigue. Then we also have some mental health conditions that bring fatigue. There is depression. Depression, this is when it is a state whereby you're moody. Yeah, like you have a low mood. That brings fatigue. Anxiety brings fatigue. Then we also have autoimmune disorders that bring fatigue. We have lupus. Lupus, this is an autoimmune disorder whereby the body produces antibodies, and as in the body fights against itself. It produces antibodies and then the antibodies fight against itself. So you develop a condition we call lupus. We also have type 1 diabetes, that is DM, that is where doesn't have insulin in their bodies, it means those people will always get high blood sugars because they lack insulin hormones in their bodies. Yeah. We also have multiple sclerosis. Those are those are examples of the autoimmune disorders that are going to bring fatigue. We also have hormonal imbalances as another point. Conditions like hypothyroidism also cause fatigue. Then we also have deficiencies. Now, the deficiencies, there are some conditions like anemia. Anemia, this is when someone lacks iron in their bodies. So in the due course, someone will be having maybe low levels of hemoglobin. Yeah, so when you lack anemia, you will get fatigue. I will explain why you get that fatigue. And we also have another deficiency, dehydration. Dehydration causes fatigue because the body needs plenty of fluids to function. So when you deprive the body from water, how is it going to function? Automatically, you will get fatigue. We also have vitamin D deficiencies, vitamin B12 deficiencies. All these things will bring fatigue. We have eating disorders, for example, anorexia, that is lack of appetite. We have overweight, obesity, underweight. So all those things will cause fatigue. We also have other chronic conditions, for example, cancer, kidney diseases, type 2 diabetes. All these conditions are going to cause fatigue. That's why I told you that whenever you experience fatigue for so long and it's not getting away, please seek for medical attention, because there will be a cause as to why that fatigue is not ceasing. So you need to seek for medical care. So those are some of the conditions that really cause what? That really cause fatigue.